Welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Bill Balanoff. Dr. Balanoff runs Smile Perfected, Renewed, and has spent years shaping how he approaches patient care with these two businesses, decision-making growth after having run a practice for many years. So we'll talk about how practices evolve, how patient trust is built, how technology is changing, and how doctors think differently once they're introduced to new technologies. So let's get into it. Thanks for coming on, Dr. Balanoff.
Well, I appreciate the invitation, and I look forward to chatting.
All right. Well, walk me through the beginning. Like, how did you get into dentistry, and when was that?
Yeah, so I originally wanted to become a pediatrician, and at a very young age, somewhere along the way, I learned that not all children live, and I just didn't have the stomach or the heart to tell parents that their child may not make it in the world. And then going to the dentist one day when I was 16 years old, the hygienist, who I must have thought was pretty at the time, said that teeth are really important and a smile is really, really important. And then the dentist walks in the room, and he was a young guy, and he said, you should consider becoming a dentist. And it's as if I was struck by lightning. Like I knew from that moment on that I was going to become a dentist. He went to Northwestern, and then I made it my mission to make sure that I went to Northwestern as well. And just loved every single minute of it, never looked at it as a job, and it's been a 43-year long hobby.
Wow. Hobby, yeah.
Yeah, it absolutely is a hobby. There's like so many exciting things to do in dentistry that I always tell young dentists is like just don't get hung up on like being chained to the chair. There's so many other opportunities within dentistry. Just open your eyes and it's really spectacular.
How long after leaving Northwestern did it take for you to start your own practice?
Worked for another guy for 2.5 years. And what I tell everybody, especially young doctors too, you have good associates and you have bad associates. And working for that guy, what he did is he taught me what not to be as a dentist, which was just as valuable. So I looked at a very tough 2.5 years and I tried to turn it into a positive. And I opened up my own practice in July of 1986. So 40 years ago.
And so when you started that practice, what did you think that was going to look like? Like, what were some core values that you said, hey, this is how I'm going to start my practice?
So when I decided to start that practice, my practice was on the east side of Fort Lauderdale. And I went back to when I graduated dental school, I taught on the faculty for the summer before I got my license. And the department chair who I worked for at Northwestern, I said to him, I said, look, I'm thinking of maybe opening up a practice on the east side of Fort Lauderdale. There's a lot of dentists there. What should I do? And he said to me, and he was like very straightforward and very, like, hey, Bill, listen to me very clearly. There's always room for a good dentist. Do not let motivation, do not let money be your motivation. And if you build your practice maybe a little bit slower, you're going to succeed in the long run. So one of the core values that I decided was I was not going to be an insurance driven or HMO kind of place. I was going to be strictly a fee for service kind of dentist who may have taken a little bit longer to kind of get going. But the patients that I eventually had were patients that I would consider my lifelong friends. And that kind of goes to the introduction of Smile Perfected. And there was this guy that was a patient of mine, and it was kind of towards the end of me practicing dentistry. And he said, I'm going to do you a favor. And he was a rich guy. And he said, I've decided to trademark the name Smile Perfected for you. And I go, why? And he said, well, the name of your dental practice was Smile Perfect. He goes, and all you've done your whole life is perfect the smile, hence Smile Perfected. And he goes, I'm giving you the trademark rights to the name Smile Perfected. And I go, what am I going to do with it? He goes, start a business. And I said, doing what? I'm a dentist. And he said, you're a smart guy, figure it out. So I thought to myself, like, what am I going to do with the name Smile Perfected? And I thought, like, what really bothers me in dentistry? And what bothered me in dentistry was the whitening process. And everybody was using Zoom. And that's really where my practice evolved into Smile Perfected. It was because of those lifelong relationships that I had with my patient. And to answer your question, the core values that I created, which was I wanted these patients to be my friends, and friends help friends. So over the course of a long lifetime, it all worked out really well for me.
And what were the major pain points that you said, hey, this needs to change, and I think that I can innovate with in the whitening space?
Well, hats off to Dr. Dorfman, Bill Dorfman. He was the one who did extreme makeovers, and he truly introduced cosmetic dentistry to the United States. And he probably doesn't get as much credit as he deserves, but I certainly credit the guy with a lot. So Bill Dorfman was involved with Zoom whitening, which was eventually bought up by Philips. And those are the only choices we had, which is patients would watch extreme makeovers on ABC. They would come into my office on Monday. Hey, I want to get my teeth whitened just like I saw on television, and let's do it. So me, like many thousands of dentists, sign up to become a Zoom whitening provider. And what no one explained to me is that the science behind Zoom really wasn't all that it was meant to be. So what I did is I took my office team and I said, what are all the things that we hate about Zoom whitening, and can we improve upon it? Because as a dentist, I had never done a whitening in my life. I mean, I had dental assistants and hygienists to do it. So they're the ones that were feeling the pain. So the first thing I needed to do is find out what they objected to and kind of work backwards from there. And that's how Smile Perfected came into being one of the number one whitening solutions in the United States.
So you were really listening to, your some of your employees that helped build or helped, manage the practice day to day. Do you feel like some of the relationships that you built with your patients, you approached your relationships with your employees in a similar manner?
Well, you have to. One of the people that works for me at Smile Perfected, she was my dental assistant 35 years ago. She's older now. She's looking for part-time work, so she works in the warehouse where Smile Perfected is. And I think to myself, if I can keep an employee around for 30, 35 years, I must be doing something right. And the reason I do this is because most dental offices, if they're struggling, if they're having a tough time, more than likely your dental assistants, your admins, and your hygienists have the answers to your angst. All you got to do is ask and listen. Because the most important person in that dental office is not the dentist. The most important person in that office is the person answering the phone. And if
Sure.
he or she is happy, then that's like the first step to like making sure your practice grows. The person with the hardest job in the dental office is the dental assistant, because
Yeah.
she's the one, when you leave, she's by default the acting dentist in the room. And if he or she is not trained on what you're doing really well, that moment of hesitation when she has to answer a question or he has to answer a question is the difference between treatment acceptance and treatment denial. So I tell dentists, please work with your office team. The front desk, the admins, and the dental assistants, they've got the answers to make you successful.
And did you see parallels? I mean, as an entrepreneur starting a practice and starting a business with, specifically with whitening, like, do you see parallels between how those practices were started and what core values were in order to make them both successful?
Yeah, so when we first started Smile Perfected, we thought we were going to take maybe like the easy way to becoming successful. Like, I'm going to just work with DSOs because, they've got 100 or 200 offices. And if I can sell to a DSO, I've picked up 200 customers in a day. The problem was implementation and the turnover at DSOs. So
Yeah.
then about 8, 9 years ago, we said, well, this is crazy because yes, you can pick up 100 customers in one day, but you can also lose 100 customers in one day. So we decided to totally change the focus of Smile Perfected, and we only work with what we like to call mom and pop dental offices, practices that are part of the community, and what I like to say, they're the fabric of the community. And those are the practices we work with, where they've got dental assistants that have been there for 5 to 10 years. They've got the dentist who's been there for 25 years, who is, coaching the little league team, whose son or daughter plays on the high school soccer team. Like, those are the practices that we work with. And just like my private practice, it took us a lot longer to grow Smile Perfected to where it is now. But once it starts to reach this momentum, it's almost like a snowball going down the hill. It starts to create mass and create velocity. We've literally doubled our business at Smile Perfector year over year by 100%.
Wow.
Believe me, it was slow going in the beginning because we had to be very judicious in the practices that we decided to become part of our family. And we treat our practices like they're our family.
And what sort of, attributes do you look at when you're doing, I guess, doing sales to those smaller practices? Like, how do you know it's going to be a good fit, or how do you know that, hey, this probably isn't the right fit?
Yeah. So one of the things we do in our training, and we tell the doctors this all the time, We love the fact that you just purchased Smile Perfected. You're not the important one to us. The people that are important to us are the dental assistants, the hygienists, and the admins.
Yeah.
And one of the things that they're required to do is everybody in the office has got to get their teeth whitened, and Smile Perfected gives the whitening kits for free. And if we've got buy-in early on of all of those admins, dental assistants, and hygienists, when they all want to get their teeth whitened, if they believe in the product and the process and what we're trying to do, and they're also told that they can have their teeth whitened anytime they want for the rest of the time that they're with that practice. Once they buy into this whole entire thing, the training, the implementation, and the buy-in becomes a really simple thing. The average office in the United States does between 2 and 4 whitenings per year. The average Smile Perfected office they'll do between 20 and 30 whitenings per year.
Wow. And so what's the catalyst for that, do you think?
It's getting the when I say, I'm sorry, 20 to 30 whitenings per month. So just
Okay,
just
yeah.
think, so it's like 4 versus 240 for the year. What's the
Right.
catalyst? It's really respecting the stakeholders within the dental practice. It's not that I don't respect the dentist. I'm one myself. But if you truly understand like who's running these practices, it's the dental assistants, and it's the hygienists, and it's the admins. And if the dental assistant says, don't get your teeth whitened because Zoom hurts you, go to the store and buy Crest white strips, that's revenue walking right out your practice. But if the dental assistant believes in your product because they've tried your product and they love their product, they're like, Smile Perfected works. Get your teeth clean. We're going to whiten them right afterwards, and you're going to walk out of here with a brighter, whiter smile. And it's a great value for spend. That's exactly the type of practices that we look for.
Sure. And what does outreach look like? Like, how are you? I mean, obviously, it seems like once you get them a chance to try the product, they love it. But how do you acquire new customers?
We actually work mostly from referrals
Okay.
because friends refer friends. And hygienists and dentists and dental assistants, they work in different practices, or maybe they move around, or whatever the case is. But one of the biggest advocates that we have is a group called the American Association of Clear Aligners, the AACA, started by David Galler. And and they account for about 150,000 Invisalign cases per year. So a big group of dentists, and these are all fee-for-service dentists, mostly general dentists, who are truly trying to give their patients a better smile. And those dentists have become some of the greatest advocates for Smile Perfected. We have some offices that literally will do 100 whitenings per month. I mean, it's just phenomenal. And it's because they understand and they trust the product. They understand and they trust the service that we give them. And the patients truly value the Invisalign process, coupling that with the Smile Perfected whitening process.
And do you feel like this turns into more of an upsell, or do you really feel that there's serious value as far as, the aesthetic of the smile for their patients?
Yeah. The number one requested service of a patient to a dentist is a brighter, whiter smile.
Hmm.
So if we start with that as a premise, and we just assume that most dentists are not making a lot of money off their hygiene, adding a $149 whitening procedure to the patient hygiene visit all of a sudden turns the hygiene department into a profit center. Not by upselling anybody, by literally giving patients what they want, which is a brighter, whiter smile, whether it's Invisalign or Invisalign with Smile Perfected. It all starts with giving the patients what they want, which is a brighter, whiter smile, and starting the conversation with them for a brighter, whiter smile. Whether it's veneers, whether it's Invisalign, and the simplest solution, of course, is just getting your teeth brighter and whiter with Smile Perfected.
As far as being an entrepreneur, I mean, starting this from scratch, what were some huge milestones of success, and what were some of the biggest challenges that you went through?
The biggest challenge for any small business is never run out of cash. So if you're going to do this, build it smart, even if it takes you a little bit longer, and do not have a lot of debt that burdens you. So those are the kinds of things that I've always followed my entire life. No debt and don't run out of cash. So we had that, which was good. What really gets a little bit frustrating is wanting to pay your employees as much as they deserve for as hard as they work, but knowing you only have a certain amount of money. And as an entrepreneur, the hardest part is to understand that you may not get paid for a couple of years. And that's okay, because when it all kind of comes to fruition, you're going to get a big paycheck at the end of the whole entire thing. And that's really what we've tried to do, grow the business smart and slow, but understand that, a guy like me is not going to get paid initially.
Did your idea of success change from when you started Smiles Perfected into where it is now?
No, because my motivation always was and always will be helping dentists thrive. Like, I want them to enjoy dentistry and being a dentist as much as I do. So if we start with that as a premise, and I've had a lot of dentists call me up above and beyond, like Smile Perfect, and they're like, hey, Bill, I'm frustrated about this, or what do you think I should do? I will help dentists all the time try to become better dentists and enjoy the dental practice as much as I could. And kind of as a caveat to that, one of the things that I invented was this appliance for the treatment of Tourette syndrome, an oral appliance which minimizes or mitigates tics. And what I did is I donated all my intellectual property to the Tourette Association of America. So any dentist in the entire world can make an appliance for a Tourette's patient, and I get no royalties out of the whole entire thing. And it's what dentists do to try and make the world a better place. Now, obviously, Smile Perfected is a for profit company. But when we're for profit, it doesn't mean that you can't just get on the phone or answer a text message to a dentist who's having a challenge with something clinically or administratively in his office, because dentists have got to help dentists. And that to me is truly what I'm trying to do, which is to help dentists win.
And do you feel like there are like common over complications that happen in practices that you experienced while running your own?
Yeah, I think probably one of the most common things is, you know, there's a book that was published a bunch of years ago called Good to Great. Love the book. And one of the things they talk about in the book is getting the right people on the bus and the wrong people off the bus. So your dental practice is this bus barreling down the road with you at the steering wheel. You need to make sure that all the people in the back, all the passengers, all your employees are there to support you and your mission, which is to provide the best possible care for your patients. If you've got naysayers or if you've got sad sacks in your office, for as difficult as it is to fire some of these people, to let them go, you're actually doing them a favor. They're not happy working for you. They don't like being in dentistry. Let them go and find the right people. And most of the time when I talk to dentists, it's dentists who have an emotional connection, because most dental offices are small. They have an emotional connection to these employees and they don't want to let them go. But they have to, because they're not happy, you're not happy, and it's starting to affect your business and it's starting to affect your patients. And that's usually what I talk to most dentists about, which is understanding that problem.
And what are the symptoms when you do have like what are the red flags or symptoms when you do have an employee that maybe isn't aligning with the values of the practice or the company? I mean, they're both businesses, right?
Yeah, they're both businesses. I think the number one red flag for most dentists is going to work and hoping that employee calls in sick. And it
Yeah.
seems kind of silly. It's like, you don't really want to work with him or her.
Yeah.
Trust me when I tell you they don't want to work with you either. And
Yeah.
if you ever have that feeling in your gut, is like, I don't really know. It's like that dental assistant or that hygienist or that person who's answering, they're just tough. Like, yeah, it's probably time for you to like just look in the mirror and say, it's time for me to like make some changes here, because it's not a healthy relationship and they don't want to be there either.
And what do you do like personally in order to make sure you're projecting positivity to emanate that across the business?
Yeah, you gotta what it all starts with. You like being a dentist? Like, is it like really part of your DNA? Do you really like it? And if you don't, then maybe you're practicing the wrong way, or maybe you're practicing portions of dentistry that you don't really like. So in my case, for as much as I love kids, being a pediatric dentist was not my skill set. It's not that I couldn't do it, but I wasn't really happy. Prosthetics and implants on the other side were my skill set. So when I get to talk to an 80-year-old guy, and I get to hear his life story while I'm taking care of him, I'm as happy as can be. Like, I love that kind of stuff. But if you said to me, Bill, you're going to do endo or pediatric dentistry, or God forbid, I'm going to do ortho, that is a bad place for Bill Balanoff to be. So understand what you like and you don't like about dentistry and just focus on that. And that's the first step towards making yourself happy with your choice as that profession.
Do you miss practicing clinically? I mean, compared to running Smile Perfected?
I do, but all of us dentists have got a shelf life, and I wouldn't equate us to professional athletes, but we really are. I mean, our lifespan's a lot longer. But what happens is you get to the point where, your eyes start to go bad, your back starts to ache you a little bit, and you have to realize that you've got to start the transition of where you want to be professionally. It doesn't mean that you can't give back to the profession. So you can do other things, whether it's teaching in a university or in my case, running Smile Perfected. There's so many other jobs that you can do. But you have to be realistic about the lifespan physically of the toll that it takes on a dentist. And usually about 30, 35 years is about most dentists. That's really what we have inside of us. The same way that an athlete only has so many years to be able to run a football or catch a baseball or, a soccer ball.
And where do you see Smile Perfected heading in the next 5 years?
It's exciting, especially after this last year when the business grows literally by, you know, two. What I look forward to is it becoming more of a common name among dentists. So we have our little niche with this, the American Association of Clear Aligners, and that's all great. And we've got our core group of customers, and we're doing really, really well, and we're happy. I just want it to be a little bit bigger, and I want dentists to say, "Oh yeah, Smile Perfected. Of course, we use it. It's like the thing we've got to use." And I really want to support those mom and pop dental offices, not so much the DSOs, but the mom and pop dental offices. That's who I really want to support. That's where I want my name to be, just a common name among dentistry.
And you were saying that ultimately this makes, dental hygiene profitable as part of the practice model. Was that initially part of, the catalyst for investing in Smile Perfected?
It was, but money is never my motivation. It turns out that once you do the right things, money kind of starts pouring in, but that wasn't the motivation. What the motivation was initially was that we had patients who wanted to get their teeth brighter and whiter, and my entire office team was telling them to go to Costco or Walgreens to buy Crest white strips. So, yes, the money was walking out the office, but more importantly to me, these patients were asking for a dental service which we refused to provide because we didn't believe in Zoom as a whitening product anymore. So part of my job is I needed to bring back the trust of these patients to my office because they were listening to the hygienists and the dental assistants. They're like, "You're telling me not to do it? I'm not doing it. I trust you." Now, when we develop Smile Perfected, now it's like, you don't need to go to Costco or Walgreens anymore. Stay with us. We're going to give you the brighter, whiter smile, and you're going to love the entire product and the process. And as a result of that trust, that relationship has garnished a lot of revenue and profit for Smile Perfected.
What's your most exciting like attribute or pitch about Smile Perfected? Like what makes it the best out there as far as whitening goes?
So patients hate to be hurt. And in every
Yeah.
single survey, when they survey patients, they say, like, why, do you have a good dentist? They'll say, "Oh, yeah, my dentist is the best. Why is that? He doesn't hurt me." Okay. Smile Perfected is not going to hurt you. We've added different chemicals to make sure that the whitening process will not hurt you. And in fact, I love when we open up a new office and they say, "Oh, Mary, our hygienist, her teeth are incredibly sensitive. Like everything hurts her." And then we do a Smile Perfected on her and she's like, "That is amazing." So, of course, being painless is the thing that we need to do because that's what patients use to judge a good or a bad practice. And I'm not saying it's fair, it is just what it is. So, Smile Perfected, one of our key attributes is we're not going to hurt you. And that's a really important part to this process.
How did you develop, like, who did you have to bring into the team in order to develop, a painless experience for whitening?
Yeah, so obviously those chemicals are proprietary. So I,
Yeah.
I don't want to share the secret sauce of Smile Perfected, but it's really just reaching out to different industries and understanding that, there's chemists out there above and beyond like dentistry. And it's like what can we do to make this better? And that's really what we did.
So I've talked to a lot of guests that are also entrepreneurs. I mean, either have started practices or are bringing new, products or services to the market in the dental industry. A lot of them say, "Hey, look, it is a patient first experience, right?" But I'm kind of curious because your money is not your main motivation. You are really about the patient and the experience of the employees at the practices. What piece of advice, would you give to somebody that's starting a business in dentistry?
Yeah, you've got to solve the problem that the patient has, and you've got to create a solution that's compatible with the clinical workflow so the dental assistants don't object to the process. So, just to repeat that again, the patients have got a problem that you want to solve. So, that's usually an easy thing to kind of figure out. but it's the process for the dental assistant, like the typically the lowest paid employee in the dental office who's doing some of the hardest work. Like, how is this process impacting that person's day-to-day workflow? And if you're not solving that problem simultaneous to what the patient wants, you're not going to be successful.
Yeah, I mean that's a great core principle to have. Thanks for sharing that. So how do people learn more about Smile Perfected?
Well, go to smileperfected.com. And also, we have our phone number, 877 624 6674. So 877 624 6674. And here's the craziest thing I'm going to do. And I've done this all along with every single thing that I've ever done in my entire life, which is my personal cell number. And my personal cell number is 954 683 2693. And when I was on the doctor's show talking about my Tourette's appliance, CBS asked me, they go like, how does somebody like find out about the research you've done on Tourette's? And I gave my personal cell number to CBS, and it's published on their website. And I've had patients around the world call me, because part of our job as a dentist is to help practices and to help patients. So when I give out the company phone number, you expect that. But if you do more than what is expected, which is to give out my personal cell number, it's because I want to help your dental practice grow and thrive. And part of it starts with a conversation with a guy like me.
Amazing. Well, thanks for coming on, Dr. Balanoff. That was very inspiring, and thanks for everything you're doing for the industry.
Thanks a lot.